Okay, we're going to start our Take a Stand webinar for November. This topic is going to be Medicare Made Easy. Our presenter is Lateshia Davidson. She is our SHIP coordinator here at M4A. I'm going to start off with some housekeeping and exactly what M4A is, as well as our area agencies on aging in the state of Alabama. I want to first thank Miss Carlette Smith over at Options and Solutions. She is the one that is going to help us get those continuing education units. Some housekeeping rules: all our evaluations should be sent to Human Resource Options. Your information submitted should be listed as what is recorded at your licensing boards, home addresses, and personal cell phone number, not your business address. Evaluations must be submitted within the 24 hours after class, no exceptions. If not submitted within the time frame, no certificate will be provided. For those who are sharing a room to view the meeting, each person does need to register for the class. Complete the class evaluation and note in the chat box to the hostess of the meetings they are in a group. We want all attendees to receive their CEUs. If you phone in, not on Zoom, please identify your phone number that you called from to cross-reference. And lastly, anyone who has not registered and their name or phone number is not on the Zoom report, you cannot receive a certificate. Alabama Aging Network operates in 67 counties. Middle Alabama Area Agency on Aging is one of the 13 local area agencies on aging. Overall mission is to age in place within the community. 90% of adults 65 and older want to stay in their homes. And lastly, we can start at the Aging and Disability Resource Center, or ADRC. Serves as a single point of entry to long-term care long-term care support and services, empowers people to make informed decisions about their long-term care supports and services through. Call 1-800-AGE-LINE to be connected to your local area agency on aging. And I will place this Human Resource Options link in the chat so that you can receive your CEU. I will now turn it over to Ms. Lateshia.
Thank you, Maria. Good morning, everyone. My name is Lateshia Davidson, as Maria said. I am the SHIP and SMP coordinator at Middle of Alabama Area Agency on Aging, M4A. SHIP, we serve the Blount, Chilton, Shelby, St. Clair, and Walker County. So today I'm going to hit on 3 objectives. I want everyone to be able to know more about Medicare, knowing that there are 2 ways to Medicare. I'm going to be able to help everybody to recognize that there are 4 parts of Medicare. And the last thing, I want to be able to empower Medicare beneficiaries, families, and caregivers to prevent, detect, and report healthcare fraud. And at the end of the presentation, I'm also going to send a link out in the chat box for a survey for today, so you can rate my presentation so I can know what I need to do or any recommendations that I need to make changes to. So with further ado, let's get into what SHIP is. So what is SHIP? SHIP is the State Health Insurance Assistance Program. Through SHIP, we have certified counselors and volunteers that are available to help Medicare beneficiaries make informed choices regarding health benefits for free. So counselors and volunteers are not affiliated with any insurance company, and we never attempt to sell Medicare beneficiary insurance. So with our program SHIP, we help beneficiaries understand their Medicare. We're going to help determine which Part D plan best fits their needs. We can enroll them in a plan of their choice. We can file a Medicare claim or an appeal. And we answer questions about any Medicare health insurance. On this PowerPoint right here, back in 2018, there was an update to the red, white, and blue Medicare card. So if you ever run across anyone that has the old original Medicare card with their social security number on there, please get them to call Medicare and get a replacement card. They made these changes due to the fraud of and having protection over people's social security numbers. So they assigned everyone a Medicare number. So this happened back in 2018. So in case you know anyone that has the old card with the social security number on there, please get that updated. So what is Medicare? Medicare is health insurance for people 65 and older. If you're under 65 with certain disabilities, if you have a diagnosis of ALS, or any age with end-stage renal disease or kidney failure. Who runs Medicare? Medicare is run by Center for Medicare and Medicaid Services, also known as CMS. Social Security Administration enrolls most individuals, and also your Railroad Retirement Board, they enroll your railroad retirees. This is the new book for 2023 Medicare and You book. This was mailed out to all Medicare beneficiaries in September. If you know anyone that needs a book and didn't receive one, please reach out to our ship department at InfoA and we will send it out in mail. So let's kind of get into the nitty-gritty of Medicare. I get a lot of people that give calls and they don't know the difference between the Part A, the B, the C, the D. So hopefully after today, I will make Medicare more easy and you will be able to know the difference. So let's start off. I want to kind of go over, there are 4 parts of Medicare. The first part is your Part A, that is your hospital insurance. Part B is your medical insurance. You have your Part C, that's your Medicare Advantage plan, and your Part D, which is your prescription drug plan. A lot of times I get most of the calls where people don't know which way to go or what is the best plan for them. I always start off to let everyone know there are only 2 ways you can go to get your Medicare. And we're going to kind of break that down to you guys. There are only 2 coverage choices. The first one we're going to start with, that original Medicare. That's what everyone receives when they turn 65 or if they're been deemed disabled or under 65. That original Medicare is that red, white, and blue card on your left-hand side. That is going to pretty much be your Part A, that hospital insurance, your Part B, your medical insurance, and you have to add a Part D, prescription drug coverage, to original Medicare. Now on this side, you see a Medicare supplemental insurance, or sometimes we call it as a Medigap policy. Those are plans that covers, they pay for what Medicare doesn't pay for. This is a plan that is extra into addition to what you'll pay for Medicare. So it's not optional. You don't have to get this plan, but basically a lot of people do get it. And like I said, it's going to pay that 20% of what Medicare will send a beneficiary a bill for. That Medigap plan will pay for that. And we'll go more in details in regards to that. The second way you can get your Medicare is that Medicare Advantage plan, or you may hear as that Part C. So the Medicare Advantage plan, instead of showing the red, white, and blue Medicare card, you will show your membership card from your plan to your provider. The Medicare Advantage plan is a Medicare approved plan, and they're owned by private insurance that offers an alternative to original Medicare for your health and drug coverage. So these plans are like your Humana, your United Healthcare, your Blue Cross, your Viva, your Cigna, and so on. The Medicare Advantage plans are also known as the bundle plans. So they're going to be your Part A, your Part B, and usually your Part D plans. So let's kind of talk about some Medicare definitions, because as I go along in the presentation, I'm going to kind of speak on these. As far as a premiums are the monthly fee you pay to have Medicare. Your deductible is what you'll pay out of pocket before Medicare starts paying for your care. Your co-payment and co-insurance are the amount you pay for services. Participating providers, These are providers that accept Medicare approved amount as full payment. And network are the doctors, hospitals, and medical facilities that contract with the plan to provide services. As I provide Medicare counseling here at SHIP at InfoA, I always get a lot of calls, as I have maybe mentioned, that a lot of people still don't know, okay, Lateshia, I don't know if I need to keep my original Medicare or is a Medicare Advantage plan is the right plan for me. The first thing I always want to let everyone know is it depends on what you have going on in your health, your medicines, your doctors, do you see specialists? So it all depends. The first thing I kind of want to go over is let's kind of talk about original Medicare. As far as the cost with original Medicare, it is a standardized Part A and Part B cost that includes your monthly Part B premiums and is 20% co-insurance for Medicare covered services if seen a participating provider after meeting your deductible. That supplemental plan under the original Medicare, that's the red, white, and blue card, you have that choice to pay an additional premium for that Medigap to cover your Medicare cost sharing. And remember, I said that Medigap or the supplemental plan that pays that 20% that Medicare will bill a person, an individual. Provider access under the original Medicare, you can see any provider and you can use any facility that accepts Medicare, participate or non-participate under original Medicare. Referrals with original Medicare, you do not need a referral to see a specialist. Drug coverage, you must sign up for a standalone prescription drug plan under the original Medicare. As far as other benefits with the original Medicare, it does not cover your vision, hearing, or dental services. And out-of-pocket limit, there's no out-of-pocket limit with original Medicare. And lastly, on the original Medicare, you will receive a quarterly Medicare summary notice. And this is pretty much a summary of services that you have received with original Medicare throughout that quarter. As far as an Advantage plan, your Medicare Advantage plan, as far as the cost, these costs are going to vary depending on that plan. Usually a co-payment is owed for in-network care. Plans may charge a monthly premium in addition to your Part B premium. Under Medicare Advantage plans, you cannot enroll in a Medigap plan. This is only Medigap plans are only for original Medicare, everyone who has that red, white, and blue plan card. Provider access on the Medicare Advantage plans, you typically can only see in-network providers. Drug coverage, in most cases, plans provide that prescription drug coverage, and some premiums may be higher depending on those plans. Other benefits under the Medicare Advantage plans, it includes that vision, hearing, and dental, and extra benefits is also offered, but it may be different premiums for that and different and out-of-pocket costs as well. Sorry. And as far as out-of-pocket limits with the Medicare Advantage plans, there is an annual out-of-pocket limit. Once a person reaches that, then the plan pays for 100% of their care after that limit has been reached. And as far as the Medicare Advantage plans, as far as the notice, they do receive monthly notice of explanation of their benefits of services they have used within that plan. So they do receive that as well. So let's talk about that Part A, your hospital insurance. The hospital insurance is going to help cover your inpatient care in hospitals. It's going to cover your skilled nursing facility care like your rehab services, but not long-term or custodial care. It's going to cover the hospice care services and home health care services. So Part A, there is no premium if a beneficiary has worked 40 quarters. So if you work 10 years in the workforce, your Part A is premium free and is free for you. But there are some individuals that may not have been able to work 10 years in the workforce, and they will have to look at paying a premium. And these are some of the set amounts for 2022 and 2023. If anyone has worked less than those 10 years, depending on the quarter, they will have to pay a Part A premium. Also with Part A, if you go in the hospital, there's a deductible that you have to pay, or they may bill you for that Part A hospital deductible. Right now it's $1,556, but in 2023, next year, it's going to go up to $1,600. with a $0 copay for each benefit period of days 1 through 60 in the hospital. So there it is going to go up for next year for that deductible for the hospital cost. Part B is that medical insurance. This medical insurance is going to help cover your services for doctors and other healthcare providers. It's going to cover that outpatient care, your home health services, your durable medical equipment like your wheelchairs, your walkers, etc. And many preventive services is what that Part B is going to cover. As far as the cost for Part B right now, it's $170.10. But for next year, it's going to go down a little bit. So it's going to go to $164.90. And this is usually deducted from Social Security check. Now, with the Part B cost, premiums can be higher based on an individual's income. And a lot of times, Social Security or the railroad will make that determination when they look back at your income to determine your Part B premium. There is a deductible also with the Part B, and for right now it's $233, and for next year it's going to go to $226. Some doctors do, and it's up to them. They do collect these deductibles sometime the beginning of the year before they provide any services. But a lot of time, but this is the annual deductible that is for Part B costs. All right, let's talk about that Part D. That's the prescription drug plan. This is going to cover most of your prescription medications that is available through your standalone Part D plans that go with your original Medicare or is sometime included in your Medicare Advantage plan. Some terminologies that I kind of want to go over with that Part D. A lot of people may be familiar with this and some may not. The Part D, there is a coverage gap that a lot of our beneficiaries, well, some beneficiaries go into, and it's also called the donut hole. So most Medicare drug plans have a coverage gap. This means after you and that plan have spent a certain amount of money, so like for right now, it's $4,430 for coverage drug. Once you have reached that amount, you must pay 25% of the cost of out-of-pocket for your drugs up to a certain limit. And for 2023, it's actually going to go up to $4,660. When you reach that amount, that means a lot of people go into that donut hole. And a lot of times, beneficiaries will know that. It depends on the medicine they take. And a lot of times, the pharmacists will let them know when this is happening. The catastrophic coverage, this is once you reach your plan's out-of-pocket limit, and right now it's $7,050, but of course it's going up to $7,400. But during the coverage gap, you automatically go into the catastrophic coverage. This coverage assures that once you have spent up to the plan's out-of-pocket limit for covered drugs, the Medicare beneficiary will only pay a small co-insurance amount or co-payment for the rest of the year. So your drugs will kind of go back down. So here at InfoA, I kind of want to let you guys know about our Senior RX program. We offer assistance for individuals that goes into that donut hole. And what Senior RX can do, they can help get that medication for free or at a reduced cost. So if you know someone that falls into that donut hole, please refer them to our Senior RX program at InfoA, or you can also do a referral online on our website at infoa.org. So one good thing that I'm kind of excited about is for some of our beneficiaries that are on insulin. The new change to Medicare Part D insulin costs starting January 1st, 2023. Plans cannot charge you more than $35 for a 1-month supply for each Medicare Part D covered insulin you take. And they cannot charge you a deductible for insulin. So what if I get a 60 or 90-day supply of insulin? Your cost cannot be more than $35 for each month supply of each covered insulin. So for example, if you get a 60-day supply of a Part D covered insulin, you generally pay no more than $70. And also starting July 1st, 2023, there's going to be another similar cap on cost that would apply for insulin that's being used in a traditional insulin pump that's going to be covered by your Medicare Part D. This also is going to apply to anyone who takes insulin, even if they receive extra help. So for insulin used with a traditional insulin pump that is covered under the Medicare Durable Medical Equipment benefit, you'll pay 20% of the Medicare approved amount after you meet that Part B deductible. So if you pay 100% for insulin related supplies like syringe, needles, alcohol swabs, and gauze, for example, um, you don't, a lot of that is going to be covered at 100% unless you have that Part D. Another way a lot of people ask about these to find out if a lot of their plans going to be covered. I always tell everyone to talk to their doctors too and their healthcare provider, because the specific amount you owe may depend on several things too. With this new change coming into 2023, I always suggest that they make sure they check with their insurance, check with their doctors for changes as well too, to make sure that it's going to be covered. But it is going to definitely be a cap. So a lot of people that are diabetes are very excited about that, because it's a lot of people that, if you know any having the loved ones that are diabetes, a lot of their insulins can be very expensive. So let's talk about that Medigap policy, which is also known as the supplemental plan. Medigap insurance provides private insurance coverage that helps fill the gap in Medicare Part A and Part B, and it's going to pay that 20% that Medicare does not pay for. There are 9 standard plans that are available, and they're designed by letters. There are no geographical limits on where care is received and if the care is received in the U.S., and these premiums are based on the age, gender, and health conditions. This plan does not include prescription coverage with a Medigap insurance. I will say Medicaps are health insurance policies that offer standardized benefits to work with original Medicare only, not Medicare Advantage plans. They are sold by private insurance. So if you have a Medigap, it pays part or all certain remaining costs after original Medicare pays first, depending on the plan you choose. Medigap will cover outstanding deductibles, co-insurance, and co-payments. Medigap may also cover health care costs that Medicare does not cover at all, like care received when traveling abroad. So just remember, Medigap only works with original Medicare. If you have a Medicare Advantage plan, you cannot buy a Medigap. It is illegal for any agent or plan representative to try to sell you a Medigap plan if you know you are enrolled in a Medicare Advantage plan. So depending on where you live and when you became eligible for Medicare, you have up to 10 different Medigap policies to choose from. And these, like I said, they are based off a letter. So you got a plan, you have an A, they may basically on B, C, D, F, G, L, M, and N. So these individual plans, they're out there as well, and they're based off the letters. And these are your supplemental plans. So let's talk about that Part C, your Medicare Advantage plans. They are referred to as, the Medicare Advantage plans. These plans often combine the services of your Part A and your Part B and your Part D. A lot of these plans offer additional benefits that original Medicare does not offer. These plans are into like different networks. You have 2 network plans. One is the HMO, which is the Health Maintenance Organization. They may require you to choose a primary doctor and get referrals to see a specialist. They also have to use doctors that are in the network. And don't forget, these plans are like your Humana, your Cigna, your Viva, your Blue Cross. These are your Advantage plans. That PPO is your preferred provider organization. This plan, if you get like a Humana PPO, or for example, these plans give you more freedom to choose doctors, and you have larger network of doctors and hospitals. But sometimes the premiums can vary as well too. So there are different enrollments that Medicare has. The first one is your initial enrollment period. This is once you turn 65 years of age, you are eligible for that Part A and Part B. This is a 7-month period, and it begins 3 months before you turn 65, which includes the month you turn 65, and it ends 3 months after the month you turn 65. This is the time when you turn 65 that you need to try to find a plan of your choice. A lot of time, if you wait after that, you will be you can be up. Well, they can penalize you if you don't find a plan after your initial enrollment period. You also have a special enrollment period. This is a time when you can change your benefits because something about your life has changed. For example, moving out of a planned service area, you have critical coverage ending, or qualify for extra help. But if nothing changed, you must wait for the annual open enrollment period. And then you have a general enrollment period. And that is if you did not sign up during the initial enrollment period for Part A or B and do not qualify for that special enrollment period, you can sign up between January the 1st and March the 31st each year. And your coverage won't start until July the 1st of that year, and late enrollment penalties may apply. And like right now, this is the annual enrollment period time. This allows anyone that's on Medicare to make any changes to their Medicare, their drug plan, their Medicare Advantage plans, or they can return to original Medicare. This open enrollment begins October the 15th and it ends December the 7th. So if you know anyone that needs to talk to me about Medicare or want to ask a question about it, this is the time to do it. Give me a call. Medicare Advantage open enrollment period during this time. You can switch to your Medicare Advantage plans. You can leave an Advantage plan to join original Medicare, and you can enroll in a Part D plan, which I just had covered that. And it's so this is from January the 1st to March the 31st of the year. This is when the open enrollment begins for the Advantage plans. And your coverage will begin the first day of the next month. So this is the time after open enrollment this time, starting January. Anyone that want to make changes to their Advantage plan, this will be the time they can do that from January the 1st to the 31st. I want to talk about Extra Help program. Extra Help through the Medicaid Saver Program is it's also known as a Medicare buy-in program or Medicare premium payment program. And this helps pay your Medicare costs if you have limited income and savings. There are 3 main programs, each with different benefits and eligibility requirements, and a lot of people do not know about this. A person can qualify for Medicaid, which can help pay costs not covered by Medicare and may offer additional benefits. The Medicare Savings Program will help people pay that Part A and Part B premium, deductibles, and co-insurance amount. Then you have that Prescription Drug Assistance Program, which helps people pay some or all their Part D premium and cost sharing. This program is referred to the low income subsidy provided through Social Security Administration. This is the income limit for 2022. We haven't got the new income limit in yet. But what are the benefits included in the Medicare savings? If you qualify for one of these main MSP, your Medicare Part B monthly premium will no longer be deducted from your Social Security check. Additionally, you will automatically get Extra Help. This is a federal program that helps with Part D prescription drug costs. Another benefit is that enrolling in the MSP, it will eliminate your Part B late enrollment penalties if you had one. The QMB, it pays for that Medicare Part A and B premium. So if you have QMB, typically you should not be billed for Medicare covered services when seeing Medicare providers or providers in that Medicare Advantage plan. Now, if you fall under the SLMB, that specific low income Medicare beneficiary, that's what that stands for, it's going to pay for that Medicare Part B premium. The QI program, the qualifying individual, it pays for that Medicare Part B program. And the LIS, the low income subsidy, it's going to help people with Medicare pay for their prescription drugs and lower the cost of Medicare prescription drug coverage. So if you know anyone that's getting that Part B premium taken out of their Social Security check and they're not receiving Extra Help, and you see that they fall up under these income limits, please reach out to me so we can get the paperwork sent out to them so they can qualify, so they can start receiving that Extra Help benefits out there. All right, shifting gears from talking about SHIP, another program that I'm also part of is the SMP, which is the Senior Medicare Patrol. This is more about Medicare fraud, errors, abuse, and how it affects beneficiaries. So what is Senior Medicare Patrol? What we do here at FOA and what I do, I'm going to help Medicare beneficiaries prevent, detect, and report healthcare fraud. We're going to help preserve the integrity of the Medicare program. And if you know anyone that would like to help volunteer as well, we are always looking for volunteers to come out and help us out in the community. So what is Medicare fraud? It is intentionally billing Medicare for services that were not received or billing for a service at a higher rate that is than actually justified. Medicare abuse. Medicare abuse occurs when providers supply services or products that are not medically necessary or that do not meet professional standards. Medicare fraud and abuse are very similar, and many times it can overlap. These are some examples of fraud and abuse. When billing for services, supplies, or equipment that were not provided, billing for excessive medical supplies, obtaining or giving a Medicare number for free service, improper coding to obtain a higher payment, and unneeded or excessive x-rays and lab tests, claim for services that are not medically necessary, and using another person's Medicare number unless someone else used your number. So what we do here at SHIP, we're going to help protect, detect, and report. And that's what we kind of go out in our county areas and we try to talk to our beneficiaries about trying to prevent healthcare fraud. So what we go out there and we talk to them about, we let them know what they need to do and what they don't need to do. And the first thing is regards to protecting themselves from Medicare fraud is, first of all, they need to treat their Medicare card and number like their credit card. Definitely watch out for identity theft. You got these folks that's calling. You got now through open enrollment, you see more commercials out there, and you having people that's coming to some of our beneficiaries' door trying to sell, and a lot of them can be fraud. So they really have to be aware. Do be aware that Medicare doesn't call or visit to sell you anything, and be cautious of offers for free medical services and always pass it on. And do not give out Medicare numbers except to your doctors or other Medicare providers. And do not carry your Medicare card unless you need it. One thing I always want to talk to everybody about, I kind of mentioned early on, is when it's kind of being more able to keep a track of your health care. For example, we here at SHIP, with the SMP poll, we have a healthcare tracker. And if you know anybody that needs it, I could send some out in mail. But it's like a calendar when they go out and they see their doctors. They kind of keep a record of what services they had. And once they get their Medicare summary notice or the explanation of benefits, they're going back to make sure they are being billed correctly for the services they receive. And this is one other part of helping empower our beneficiaries to just try to keep a track of their health care coverage. The step 3 is always to report suspect Medicare fraud and abuse. In case someone does, they need to always call the provider, gather information and documentation, and we always encourage them, they can always contact us at SMP. This is a free and confidential services. A lot of time we have, like recently I had someone that went to our county area in Blount County, and they went to our beneficiary home, and they were saying they was from our SHIP office, and they was out there trying to sell insurance, and so happened the beneficiary called the residential office, and they called us, and they was able to get all the information on that person that was there. We did an investigation, and I also reported to our state office. So we actually do a very good job at trying to help protect our beneficiaries and try to stay on track of trying to watch out for these individuals that's out there trying to fraud our clients, our beneficiaries. So we definitely always trying to educate them on being mindful of these services that's out there, and then knowing that there is service out there that will help protect them. Going backwards. Okay, so this is my card right here. I'm Lateshia Davidson again. I'm with the State Health Insurance Assistance Program, the SHIP program, the SMP coordinator. I do it both. And I do want to add, if y'all run across anyone that needs SHIP assistance, right now we have different events in our county areas that I'm located in, different libraries. They can just walk in. They need their Medicare card and their medicines, and I can help them do a plan comparison. I always encourage anyone that is on Medicare to always do a yearly Medicare check as well, because medicines may change, plans change, And they can always reach us, and we can always just look at their plans and make sure that plan is going to pay, and the medicine is going to continue to be paid out for the next upcoming year. So it's always good to do a Medicare checkup on their plans during that open enrollment time as well. We do home visits as well, because a lot of our beneficiaries may not be able to read their medicines to me. So I can do home visits. They can come to the office, or we have a different location sites in our 5 county areas that we are also out in. And it's located on our website, those dates and those locations where I will be. So we had one in there that asked what's the best way to go choose a Medicare plan, original Medicare, original Medicare, or Medicare Advantage. Like earlier, it just really depends on your health. It depends on what you have going on. It depends on your medicines. It depends on the amount of doctors you have. So that is something that I kind of go over when when I sit down and go over an individual. We kind of look at all that. We look at your medicines and things like that. So it kind of depends on a beneficiary. Once I kind of explain it, we can kind of look at it like I use the Medicare.gov website. And what we do, we look at a list of your medicines and we kind of plug them in, and it kind of pulls up the plans that's best, Medicare.gov best says is the best fit for you. And it all depends on, if you have a lot of doctors, do you want to be like in a plan that's strictly in network? It just kind of depends on that. And I was answering a question that was put out there as far as the best way to choose a plan. You have any questions, you can always give me a call. You can send me an email. I will be happy to answer any questions. Don't forget, I put the survey in the chat. If it's anything that you kind of want to think I need to add on to my presentations or talk about, please add that on there. I'm always open for any new suggestions.